Welcome back, viewers. You're still watching Good Life, the health show with me, Pooja. And it's time now to move on to a subject which plays a very crucial role in our lives. And in order to our bodies to function properly and stay healthy, it is important that we follow a good nutritious diet. And today, the topic which we have taken is child obesity. And to discuss on the topic, we have with us our nutrition expert, Tina Baby Bora. So, Tina, welcome once again to Good Life, the health show. So, today we have taken the topic child obesity. So at first, important what the parents should take care of the diet chart of their children. So on that.
Yeah, as we have before also we have discussed regarding the child obesity. Now it's become an epidemic, and you can say that like parents may have like little knowledge or have no knowledge regarding how much the weight should be the children should have as per the height and age of a particular child.
Okay.
So this is very important to consider. And then if a child is found to be obese, then it is very much required that they should go and see a pediatric doctor.
Okay.
Because if they keep on gaining the weight, then later part of life they may have multiple disease, like they may have deposition of fat in the liver, which we get often on children like this in our own hospital, this is Excel Care Hospital. And also they may get like cardio problems, maybe having high BP, and then the cholesterol level may raise up because of excessive weight. So it is very much needed for the parents to have proper knowledge regarding what should be the diet chart of a particular children. So it depends upon the portion controlling, how much you are feeding the child. This is very, very important. It's not like your child is hungry that you will just keep on feeding the child. So they also have a stomach, a space. So on that aspect, you have to feed the child. And what type of food you are giving to your children. This is very much, important to keep on eye on that, because if you give much of junk foods and then if you keep on giving them refined sugar, maybe like sugary food drinks and all, which usually the children are very fond of having.
That has to be taken care by the parents.
Yes, if they are taking like, if they are taking 3 times rice, morning, if I have found some children, they take 3 times rice. On the top of that, if they keep on taking like those ready-made fruit drinks and all, because those are like added sugar, so that may enhance their, blood sugar level also at one point of time if they keep on increasing their weight. So this has to be controlled. And then mostly the packet food items. Earlier also I have mentioned that partially saturated fat is much more dangerous than the food items which is contain only saturated fat, maybe butter, cream, ghee and all. So that can be taken, but limitation is there. If you allow your child to have a liberal amount of like saturated fats, and also with that if they keep on taking the packet food items like bhujia or chips and chana and all sort of like nowadays nuggets that are coming up in the market, if with that also if they keep on taking usually their homemade food, they will start gaining weight. And also the environmental factor also matters a lot in for the children.
All right, Tina, we have a phone call. Hello, who's calling?
Hello.
Hello.
Koksun. Mane ei bachcha gane kiba sudibo lagisile.
Koksun.
Mane mor bachcha ta ase.
Apnar prashnoto kori thakok.
মানে হিয়াৰ মানে একচুয়ালি মই আগৰ ডক্টৰক ফোন কৰিছিলো প্ৰাকৃতিক এটো নাপালো।
আচ্ছা।
তাৰ প্ৰবলেম হৈছিল তাৰমানে তাৰ ওঠটো কলা পৰি গৈছে।
আচ্ছা।
মানে আজি 15-20 দিন মান হল কমা নাই।
Actually, আমি এতিয়া নিউট্ৰিশন এক্সপাৰ্টৰ লগত বহি আছো, তো তেখেতৰ লগত কথা পাতিবলে আপুনি আকৌ আমাক কল কৰিব লাগিব। সো এতিয়া ৰাইট নাও আপুনি যদি আপোনাৰ কিবা প্ৰশ্ন আছে ডায়েটক লৈ আপোনাৰ বাচ্চাৰ মানে কেনেকুৱা কি খোৱা চাব লাগে, হেতু প্ৰশ্ন যদি কিবা আছে আপুনি কৰিব।
হিখিনি কলেও ভাল হয় না, মানে মোৰ হিখিনি কলেও ভাল হয় মানে।
আচ্ছা, খোৱাখিনি অকমান লাইক she wants to know about the diet. আচ্ছা, ঠিক। কিমান এজ আপোনাৰ বাচ্চাৰ?
এটা মানে নৱেম্বৰ 2 বছৰ হ'ব।
নৱেম্বৰ 2, আচ্ছা, 2 years November.
If the child is going to be 2 years, then
what would be a good amount of diet for the children?
Right, they should give a balanced diet, comparison of like rice, dal, vegetables and legumes, as I already keep on telling all the parents that concentrate on the plant protein more in early childhood, because it will give you ample amount of protein. It will help you in your growth and development, and also it is rich in fiber. So there won't be any problem of constipation and all in terms of like children. And
so I'm sure the viewer who have just asked the question, it was not proper question for her, but like she has also mentioned about the diet chart for your children, and I'm sure you must have been benefited. So Tina, we are really short of time and we have like less time with us. So in short, if you want to tell the parents out there to how to have a balanced diet for their children to not make their children obese, so what would you say on that?
Yeah,
we have really short of time.
Right, it is very much important that you should cut down the saturated fat part and the simple carb. Simple carb may be those of like sugary food drinks and mostly the bakery food items if a child is obese. Concentrate on the homemade food mostly, and saturated fat is not that bad, rather than the partially saturated fats. Those are found in the packet food items.
These are the basic things actually one should remember. I'm sure the parents who have just heard her, Tina, saying that packet food items, which is really available these days, and your children are more prone to you, but it is your duty, your parents, it's your duty that you have to have a stop on that, if not completely, but should have a control on that, on the food items. Tina, I'm really like surprised to tell you that, but we are really short of time, but we can have a conversation in our next episodes as well. But right now I want to thank you a lot for giving such a valuable time for your busy schedule and coming to our show and sharing your thoughts on the topic. We will continue still this topic on our next episode. So I'm sure viewers, you have just heard Tina telling about the children who are obese and what kind of diet you should take up with your children, and what kind of control and how you should take care of your children to have a happy-go-lucky life. All right, on that note, we'll have to wrap up the show of Good Life, the Health Show right now. We hope that we were able to answer all your queries in the best possible way. But in our next episode, we will be discussing on some other important health issues. So if you have any queries, do join us next Wednesday at 4 p.m. live. So until then, stay healthy, stay fit, and keep watching Northeast Live. Goodbye. Welcome back, viewers. You're still watching Good Life, the Health Show with me, Pooja, and I'm still joined by Dr. Prakritish Bora, and we are talking about influenza or flu. So let's go straight away to him and talk more on the topic. So, Doctor, coming back to you again, if we talk about the control of the infection, so what do you have to say on that? How to control?
See, if you know the mode of transmission, that is where we are going to block the virus from spreading. So, like as I said, direct contact. So, many times it is difficult to know that whether a person who is apparently looking healthy has the infection or not.
Okay, doctor will continue that conversation. We have a phone call. Okay, hello, who's calling?
Hi.
Coxon, hello.
Hi.
Hello. আপোনাৰ টিভিৰ ভলিউমটো অকমান কমাই দিব, তাৰ পিছত আপোনাৰ প্ৰশ্নটো কৰিব।
কমাই দিছো মই।
কওক, এতিয়া কওক।
মোৰ ছোৱালীজনী বয়স 5 বছৰ। এই আজি 2 সপ্তাহমান হ'ল, তাই মানে গোটেই গাটোৰে ৰঙা ৰঙা পৰি মানে ৰাতি ঠিক 10টা বজাত গোটেই গাটোই তাই মানে ৰঙা ৰঙা হৈ চকা হৈ মানে খজুৱাইছে, আৰু গোটেই গাটোতে তাই মানে ৰঙা হৈ আমি ভাবছো এলাৰ্জি হৈছে, আৰু গা ধুবলৈ ইচ্ছা নকৰে।
গোটেই গাত ৰঙা ৰঙা হয়, এলাৰ্জি টাইপ হৈ গৈছে।
এলাৰ্জি টাইপ হৈ গৈছে।
3 বছৰ বুলি ক'লে?
3 years। 5 বছৰ।
আচ্ছা, যোনটো ৰঙা ৰঙা হৈছে সেইটো গুটি গুটি হৈছে নে চকলা চকলকে হৈছে?
না, চকলা চকলি হৈছে স্যাৰ।
চকলা চকল হৈছে। এতিয়া চাওক, আপোনাৰ ছোৱালীৰ মোষ্ট লাইকলি আৰ্টিক এৰিয়া বুলি কওঁ এবিধ এলাৰ্জি যোনটো হৈছে, আৰু যাৰ আৰ্টিক এৰিয়া হয় তেওঁলোকৰ এলাৰ্জিৰ কাৰণে টেণ্ডেঞ্চি বেছি থাকে। সেইটো আৰ্টিক এৰিয়া বুলি নহয়, যিকোনো ধৰণৰ ছালৰ বেমাৰ, ইভেন কাহ চৰ্দি, এনেকুৱা ধৰণৰ এলাৰ্জিবিলাক চকুৰ এলাৰ্জি বেছিকৈ হ'ব পাৰে। গতিকে এলাৰ্জি আমি যেনেকৈ জানো, এলাৰ্জি পূৰা কিয়ৰ নাই, সেইটো সম্পূৰ্ণ ভাল কৰিব পৰা নাযায়। যেনেকৈ ডায়েবেটিছ হ'লে সেইটো সম্পূৰ্ণ ভাল নহয়, আমি কণ্ট্ৰলতহে ৰাখিব পাৰিম। ঠিক তেনেকৈ এলাৰ্জিও আপুনি কণ্ট্ৰলত ৰাখিবলৈ শিকিব লাগিব এতিয়া আৰ্টিকেৰিয়া যে হৈছে এইটো বিভিন্ন বস্তুৰ পৰা হ'ব পাৰে খোৱা বস্তুৰ পৰা পিন্ধা কাপোৰৰ পৰা গাত লগোৱা বস্তুৰ পৰা ধূলিৰ পৰা মহ মাখি পোক পৰুৱাৰ পৰা সো আপুনি যেহেতু তাৰ লগত অনবৰতে থাকে আপুনি চেষ্টা কৰিব লাগিব যে কি বস্তুৰ পৰা এইটো হৈছে কাৰণ এলাৰ্জিৰ এটাই ৰাস্তা যে যোনটো বস্তুৰ পৰা হৈছে সেইটো বস্তু আমি এৰি চলিব লাগিব এটা কেতিয়াবা খালি এটা কথা যে এই বস্তুটো উলিয়াব নোৱাৰিলে আমি কি বস্তু এৰি চলিম সেই বস্তুটো গম পোৱাটো অসুবিধা হয় কিন্তু কেইটামান জেনেৰেল কথা কওঁ আপোনাক যে তাইৰ ছালটো মই আগৰ জন দৰ্শকো কৈছিলোঁ যে ছালটো আমাৰ কোমল থাকিব লাগিব আৰু তাৰ কাৰণে মইশ্চাৰাইজিং ক্ৰীম লোচন লগাই ছালটো কোমল ৰাখিব লাগিব যাতে ড্ৰাই স্কিন নহয় ড্ৰাই স্কিনত এলাৰ্জিবিলাক আমাৰ বেছিকৈ হোৱা দেখা যায় 2 নম্বৰতে ঘামিলে এতিয়া গৰমৰ বতৰ ঘামিলে যদি আপুনি এলাৰ্জি বাঢ়ে বা ঘামচি তামচি বেছিকৈ হয় সো ঘামত থাকিব নিদিব ঘামৰ কাপোৰ সোনকালতে সলাব ঘাম মুচি দিব গাৰ পৰা আৰু ধূলি মাকতি মহ মাখি পোক পৰুৱাৰ লগত সংস্পৰ্শ নোহোৱাকৈ ৰাখিব পাৰিব লাগিব এইকেইটা কৰিলে মই ভাবোঁ যে কিছুমান এলাৰ্জি বহুত পৰিমাণে কমি থাকিব কিন্তু যোনটো আৰ্টিকেৰিয়া হৈছে সেইটো ইমিডিয়েটলি ভাল কৰিবৰ কাৰণে আপুনি এলাৰ্জি মেডিচিন খাব লাগিব যেনেকৈ আপোনাৰ ক্লিমাষ্টাৰিন ফিউমেট বুলি এটা দৰৱ আছে যোনটো আপোনাৰ ছোৱালীক আপুনি 5 ml 1 চামুচকৈ দিনত দুবাৰ 7 দিন 10 দিনমানৰ কাৰণে দিব পাৰে গাত লগাবলৈ কেলামিন লোচন পোৱা যায় সেইটো দিলে অলপমান তাই খজুতিটো কমিব বা ইৰিটেশ্যনটো কমিব সেইটো আপুনি দিনত দুবাৰ তিনিবাৰকৈ লগাব পাৰে আৰু এইখিনি কৰি যদি 5-7 দিনত কমি যোৱা নাই তেতিয়া আপুনি এজন ডক্টৰক দেখাই লোৱাটো ভাল হ'ব আৰু যোনটো গা নোধোৱাৰ কথা কৈছে সেইটোতো কিছুমান ল'ৰা ছোৱালীৰ সেইটো স্বভাৱৰ নিচিনা হয় যে গাটো ধুবলৈ বেয়া পায় বা পানী বেয়া পায় চ' সেইটোত বেলেগৰ ৰাস্তা নাই তাইক বুজাই মেলি কাৰণ 5 বছৰীয়া যাতে তাই বুজি পাব গা ধোৱাটো কিয় পৰিষ্কাৰ থকাটো আমি কিয় প্ৰয়োজন পৰিষ্কাৰ থাকিলেহে যে তাই এলাৰ্জিবিলাক আঁতৰিব তাৰ ইনফেকশ্যন নহ'ব সেই কথাখিনি বুজাই মেলি তাইক গা ধুৱাব কুহুমীয়া গৰম পানী ব্যৱহাৰ কৰিব চাবোন চেম্পু দিব পাৰে কিন্তু গা ধোৱাৰ পিছত এটা মইশ্চাৰাইজিং ক্ৰীম সদায় সানিব
All right, doctor. Doctor, we have another call. So, hello, who's calling? Hello. Oh, Cox.
Sir, মই ছাৰৰ লগত কথা পাতিব বিচাৰিছোঁ হয় মোৰ ছোৱালীজনীৰ বয়স 3 বছৰ 6 মাহ তাই মানে খুব ঘনাই চৰ্দি হৈ থাকে মাহত এবাৰ হৈ যায় তাৰপৰা কেনেকৈ মই নিৰাময় পাব পাৰিম
তাই উশাহত কষ্ট পাইছে নেকি কেতিয়াবা কফ হৈ
নাই উশাহত কষ্ট নাপায় ৰাতি শুওঁতে অলপ কাহটো বেছি ধৰে আৰু তাই এনে অকণমান নাকটো বাজে আৰু তেতিয়া কাহটো আহি যায়
আপোনালোকৰ পৰিয়ালত আপোনাৰ ফালে বা দেউতাকৰ ফালে কাহ চৰ্দি এজমা সাইনাছ প্ৰব্লেম স্কিন এলাৰ্জি ডাষ্ট এলাৰ্জি এনেকুৱা এলাৰ্জিক বেমাৰ আছে নেকি কাৰোবাৰ
এনে এজমাৰ তেনেকুৱা নাই স্যাৰ কিন্তু ডাষ্ট এলাৰ্জি মই নিজেও কেতিয়াবা অকণ ধূলি পালে মানে অলপ নাকটো খজুৱা হেৰি হয় এনেকুৱা ভাৱ এটা
আচ্ছা এতিয়া চাওক আপোনাৰ ছোৱালীৰ যোনটো কথা কৈছে এইটো আমি এলাৰ্জিক ৰাইনাইটিছ বা এলাৰ্জি আছে যোনটোৰ পৰা তাই কাহ চৰ্দি সহজতে হয় গতিকে যিমান দূৰ মই বুজিছোঁ তাইৰ ট্ৰিগাৰটো নেজেল মানে নাকত বস্তুটো আৰম্ভ হয় তাৰ পৰা তাই কফ হয়গৈ আৰু এইটো আজিকালি খুব কমন বস্তু যিহেতু তাই এতিয়ালৈকে উশাহত কষ্ট পোৱা নাই যোনটো আমি চিভিয়াৰ হুইজিং বুলি কওঁ তেনেকুৱা হোৱা নাই গতিকে আপুনি খুব এটা চিন্তিত হ'ব নালাগে এনেও এই বয়সত এবছৰৰ পৰা 3-4 বছৰ 5 বছৰ বয়সলৈকে সৰু ল'ৰা ছোৱালীবিলাকৰ কাহ চৰ্দি বেছিকৈ হ'ব সিহঁতৰ ব্যৱহাৰৰ কাৰণে সিহঁতৰ স্কুলত যোৱাৰ কাৰণে বিভিন্ন ল'ৰা ছোৱালীক খেলাৰ কাৰণে চ' বিভিন্ন কাৰণত কাহ চৰ্দিটো হয় গতিকে সেইটো যদি চৰ্দিতে আছে খুব বেছি কনজেশ্যন কফ হোৱা নাই নিমনিয়া হোৱা নাই বা উশাহত কষ্ট পোৱা নাই খালি সুধা কাহ চৰ্দিৰ কাৰণে আপুনি ইমান চিন্তা কৰিব নালাগে নাকটো চাফা ৰাখিবৰ কাৰণে আজিকালি বিভিন্ন ধৰণৰ চেলাইন নাকত দিয়া ড্ৰপ পোৱা যায় তেনেকুৱা এটা চেলাইন ড্ৰপ আপুনি দিনত 4-বাৰ 5-বাৰ যিমান লাগে ব্যৱহাৰ কৰিব যাতে নাকটো চাফা থাকে কাৰণ আপোনাৰ ছোৱালী বোধহয় ট্ৰিগাৰটো নাকত আছে গতিকে নাকটো ক্লিন ৰাখিলে তাই চৰ্দি কাহটো কমি থাকিব 2 নম্বৰতে যদি খুব ঘনকৈ হৈছে আমি কিছুমান নহ'বৰ কাৰণে মেডিচিন কেতিয়াবা দিওঁ এলাৰ্জিটো কমাই ৰাখিবৰ কাৰণে যেনেকৈ লিভোচেট্ৰিজিন বা মন্ত্ৰলিকাছ এনেকুৱা ধৰণৰ মেডিচিন দিয়া যায় কিন্তু সেইবিলাক দিবৰ কাৰণে ছোৱালীজনীক নোচোৱাকৈ দিবলৈ দিগদাৰী হ'ব আপুনি আপোনাৰ ব্যক্তিগত শিশু বিশেষজ্ঞৰ লগত এবাৰ কথা পাতি তাৰ বিষয়ে চিন্তা কৰাটো উচিত
All right, yeah, that's absolutely you have mentioned, and it's a very correct information that without seeing the child, it's not necessary that we should tell all the medicines because it's not precautionary and to tell.
Some of the medications can be given, but
yeah, some of the medications can be given. A basic medication can be given, but not the proper one. Maybe some other disease might have affected the children. So, doctor, we were talking about the infections, how to control that. So, what do you have to say on that?
as I said, if we know the mode of transmission, then we know what to do. So as I said that close contact with a person should be avoided. But in influenza it is not possible always, because asymptomatic person who's in that window period, he's got the virus but he doesn't have the symptoms. So that window period you will not know whether that person is suffering from influenza or not. So avoiding that person can be difficult. But still, as a rule of thumb, it is better to avoid crowded places, close contact with people. There were times, in the times of epidemics, even people used to avoid shaking hands. So I don't think it should go to that length also. I mean, but then it should be always followed by washing your hands, and without washing your hands, not to touch your face. Eyes, nose, mouth.
Okay, doctor, we have another call. Okay, who's calling? Hello. Oh, hello. কওকচোন আপোনাৰ প্ৰশ্নটো কওক। হেল্ল', আপোনাৰ ধৰিব পৰা নাই, কি প্ৰশ্নটো আছে আপোনাৰ কওকচোন। ডক্টৰ প্ৰাকৃতিশ বৰা আমাৰ ষ্টুডিঅ'ত আছে।
মোৰ গাটো খুজাই হয়, কিবা পানী পানী ওলাই থাকে। হেল্ল',
না আপোনাৰ বেবি নে আপোনাৰ?
মোৰ বয়স 35 বছৰ হৈছে। 34।
আসলতে মই শিশু বিশেষজ্ঞহে, গতিকে আপোনাৰ যোনটো কথা হৈছে সেইটোত মই মোৰ পৰা কিবা এটা ক'বলৈ বৰ দিগদাৰি হ'ব।
All right. Thank you so much for calling. Okay, so she had a question for herself, but that's fine. But if you have any queries, I'm sure you must see any of the doctor nearby you or any of your family doctor, and you can get all your answers of your query. So doctor, coming back to you again in short, because we have very short of time, like we were talking about the infection, so
control
on infection.
So one is avoiding crowded places, avoiding people who might have the disease. Then the most important is washing hands. So washing hands is not only for flu, but it's for all kind of diseases which come by your hands. So washing hands, you are avoiding spreading the infection, you are keeping yourself healthy. So washing hands is of paramount importance. And then we come on to vaccination. So routine vaccination will definitely keep you away from influenza, especially people or children who have high risk to get influenza. So for me, children with asthma, with allergic rhinitis, with allergic cough and cold, sinusitis, these are children I normally advocate to get vaccinated. And anybody else who wants to otherwise also vaccinate. So vaccination is of paramount importance to keep influenza out of our...
And one should not have any kind of confusion that vaccination should not be given at any time, because it's very important for your children, isn't it, doctor?
Absolutely.
So doctor, thank you so much for coming to our show. It was like privilege to have you in our show, and we had a lot of discussion. It was a short of time. We had so many discussions and conversations to do on the topic, but I'm sure the viewers who have just watched our show must be benefited by all the answers and all the views and all the information which Dr. Prakritish Bora has just mentioned. And this is a live show. The phone lines are open. You can call at any time and ask your queries. But on that note, we'll slip into a short break, but do come back soon, because we have lots more on the other side. Hello and welcome to Good Life, the health show with me, Pooja. Well, this is a show that focuses on providing you with solutions to your health-related issues, lifestyle, and much more. Well, viewers, influenza, commonly known as the flu, is an infectious disease caused by an influenza virus, and symptoms can be mild to severe, and the most common symptoms include high fever, running nose, sore throat, muscle pain, headache, and feeling tired. And you have guessed it right. Well, viewers, today the topic which we have taken is influenza in children. And to discuss on the topic, we have with us Dr. Prakritish Bora, who is a well-known pediatrician. So not to waste any more time, I'll straight away move to him and talk more on the topic which we have taken today. So Dr. Prakritish Bora, welcome to Good Life, the health show. It's a privilege to have you in our show today. So today the topic which we have taken, and nowadays which we have seen these days, influenza or flu, which is commonly known as. So first of all, we would like to know you about the term, and also to our viewers, you let them know what is all about?
Flu is commonly used, but although it is actually influenza, which is a viral infection which is very similar to common cold that we have.
Okay.
The normal cough and cold that we normally suffer in winters or even in summers is a similar kind of disease, but influenza has gained popularity, or in terms of mortality, it has been quite significant in certain epidemics.
Okay.
So that's the reason influenza has grown in popularity as well as in terms of awareness. So like any other viral infection or like common cold, influenza normally will have a more severe course, wherein the fever will be very high. If we start from the head, then there will be headache, and then you might have a little bit of watering eyes, then you might have congestion in the nose. Coming to the mouth, you might have a little bit of sore throat.
Okay.
And some influenzas even can cause ear infection and lead to ear pains. Then coming down in the severe form, when influenza can complicate into a pneumonia, which can be primary viral pneumonia or a secondary bacterial pneumonia, because when a virus attacks you, your immunity level comes down. That is the time other bacteria present in the environment can get opportunity to cause an pneumonia. So in the lungs we'll have pneumonia, and if you get into a situation where this pneumonia can lead to a situation called ARDS, and that can lead to even multiple organ failure like kidneys, liver, etc. And then secondary infections can happen and rarely even presentation of encephalitis like presentation, where your brain will swell up, you'll have headache, you'll go into coma, you'll throw fits or seizures. So this is the spectrum. If we overall, if you see the spectrum of the disease, this is somewhat the spectrum.
Okay, so this is somewhat, and one has to be very careful. If suppose someone finds some of the basic symptoms or something like that, so they should not ignore. If suppose a child is suffering from fever for quite a long time, and if you are curing at home, so you should immediately see a pediatrician, isn't it, doctor?
Right.
So what is, like if we talk about influenza and flu in children, if we talk about that? So
see, influenza as such is a disease which commonly affects the younger age, that is children, and the older age, after the age of 60. And of course, people who have an underlying disease like a heart disease or immunocompromised state like HIV, or a person who has cancer, in these people are easily prone to flu or influenza. And because it's a seasonal disease, it normally is seen after October. This time the 2018 prediction is that we are going to have more influenza cases probably in the month of November, December.
Because the weather conditions, the climate has also changed a lot.
So because these viruses thrive mostly in the winter conditions, and they thrive better in the environment to infect other people who come into contact. So that is the reason, and there are in fact two different cycles in the two different parts of the world. So accordingly, the vaccine is also developed in such a way that the two zones of the world will have two different vaccines for the same disease.
So two different vaccines.
Because when we talk about the virus, the influenza virus, we are basically talking about an orthomyxo virus. It's a group of the virus, and it has 4 subtypes.
4 subtypes.
Well, the first one is the A, B, C, D. Here, A is the most severe subgroup, which can cause very severe disease in a person. And normally you see this subgroup, who are normally located in birds. So they are called avian flu, because they normally come from birds. And these viruses are very highly mutagenic. They get mutatic very easily, and their antigenic variability is very high. So which is why they have the capability to cause epidemic. I mean, they can infect people in a large amount. So so A is the commonest, one of the commonest subtype. Then we come to B. B is less mutagenic, and the antigenic variability is also less. So, but it is a virus subgroup of the virus which exclusively affects only human.
Only to the humans.
Not other animals. but it can affect a few other animals, like ferret. There is an animal called ferret, so it can ferret. So it can cause, in fact, it can locally inhabit that animal, but those animals are not seen in India. And then we go to the subclass C. So these are inhabited of bovine and pigs. They normally habitat these animals, and they infect humans. And again, they have the potential to cause epidemics and pandemics. And then we come to the subgroup D, which is rarely seen in human, but it has the potential to cause infections in human as well. But basically, when we talk about epidemics of influenza, then we're basically talking about either A or C.
Okay, A or C. If we talk about like in a general, but we talk about A and C, isn't it? Okay, the viewers, I would just like to repeat once again that this is a live show and the phone lines are open, and Dr. Prakritish Bora is here, and we are talking about influenza or flu, which is in a common term. So the phone lines are open and the phone numbers are flashed on your television screen. So if you have any queries, if you have any questions regarding anything, you can call us, and Prakritish Bora is here to answer all your queries. So coming back to you again, doctor. So we are talking about influenza, which is a common term, we can say. So whenever a patient comes to you, whenever a parent comes to you, so what kind of suggestions do you give at first to them? Like how to take care of their children?
See, if you are talking about prevention, there are only 3 ways we can prevent influenza from coming to you. And we should be more careful if an epidemic like situation is there. Like in 2009, we had a epidemic, I think it was H2N2, the subtype of the virus which caused this epidemic. And in 2004 we had a severe epidemic which was caused by H1N1. So those are, and then there were subsequent epidemics as well. But so in this situation especially, you have to be very careful not to get yourself infected. And the 3 ways that the virus comes to you, the first is being direct contact. A person is infected and you come into direct contact with that person. Second is airborne. Suppose I cough out, then I'll cough out, I'm infected and I cough out, then about 500,000 of the virus will come into the air. And if you are in close proximity with a person like that who's coughing, then you'll have the potential to get infected. And the third is by bringing it to your body. Suppose the infected person had touched this place, and you touch it and touch your eyes, nose or mouth, which is the easiest way to get yourself infected, then you will get the infection into your body. So, so basically avoiding crowded places and being selective about where you take your children, where they play. Secondly, washing your hands, because your hands will bring on the infection onto you. So strict hand washing, nutritious diet, adequate amount of fluids. So this is what is going to prevent the infection. And but the most important thing we should not forget is vaccination. So children at risk, children even without risk are nowadays given this vaccine.
And so timely vaccination is very important.
Timely vaccination. The only issue here is because the virus has the potential to keep on changing its color, or what we call as mutation. So this vaccine that we take only works for a year or so. So every year the new mutation of the virus is detected, and accordingly the vaccine is developed, which takes about 6 months. So the virus, again, this vaccine has to be produced in adequate amount. Many times we face that the vaccine is not adequately available. There are a lot of issues, but because of the mutagenicity of the virus, all these problems are there. And most of the other vaccines that we need to take 1 or 2 shots or 3 shots maybe, or a booster, and you are protected. But with this vaccine, the problem is you have to take it every year so that you are protected against this disease. So children who have asthma, who has allergic rhinitis, allergic cough and cold, and who are immunosuppressant like a nephrotic syndrome, or a child with HIV, or a child who has cancer, are the targets where we need to vaccinate so that this influenza will not be able to cause harm to them. And I was trying to tell you another thing. Again, the vaccine. Again, the vaccine is optional. I mean, it's not a compulsory vaccine. So the parents will have to be given this information that this vaccine doesn't come on a normal routine. So anyone interested because it comes with a price. So anyone interested who can afford it, so this vaccine should be given.
And it's very important to have a proper information and to give a proper information to the parents as well, because sometimes we see that parents are really very confused and they hear from others also that these kind of vaccinations are out. But I feel that like there a proper consultation by the doctor is very important, isn't it? If you hear from somewhere, but at least a second thought is very important, isn't it? Okay.
So as I was saying, the recent outbreak that we had was controlled to a high, I mean, to a good extent because the measures were adequate. People are more aware. I mean, and we should also inculcate healthy habits in a child.
Okay.
Like
that's very important.
Yeah, like not coughing out. We have to teach our children not to cough out open in the air. They have to cover their face. And if you're in a crowded place, you can wear a mask for you to not get it back or get the infection, and for your viruses to not go out in the environment. Then eating healthy food, vegetables, fruits, and a lot of water or liquids.
Okay.
So the healthy habits will definitely bring the infections down in children.
All right. So doctor, we have a phone call. Let's take the phone call. Hello, who's calling? Hello. Hello. I think the phone has been disconnected. So we were just talking about the healthy habits that the children should be known and the parents should teach their children, isn't it? So these are the basic things. So what were more points you want to add on that, doctor?
See, as I told you the symptoms. So in the treatment part, there is not much, although there are new drugs now which are available. But those are normally, reserved for children who will have severe form of influenza, say with pneumonia. So I would like to tell you the risk factors which will tell you that this influenza could be stronger or it could be more serious in a child. So if the fever is very high grade, normally it will come with chills. But if you start having breathing difficulty, you're panting for breath, or the child is having breathing difficulty in breathing, he is not feeding well. He's not feeding well, refusing feeds, and he is looking lethargic. Those are times when you have to immediately see a doctor. So the complications.
So one should not ignore those symptoms.
So those are the signs where you know the complications of influenza has set in, and this kind of children should be immediately hospitalized and properly managed. Otherwise, influenza, although it is a little higher form of cough and cold, the normal cold that we have, but it will give you more pains, more aches, more headaches, and more symptoms. So you may have to take paracetamol for fever and a lot of liquids to keep you hydrated. So only these measures can take care of the normal flu. Only the complicated ones will need to be treated in the hospital. And there is a new drug now which is available in India. It's called oseltamivir, and this drug can definitely reduce the duration of the disease and also reduce the severity of the disease.
Okay. Doctor, we have a phone call, so we'll take the call. Hello, who's calling? Hello? 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 Okay, something went wrong with the phone. So we were talking about the new pills and you were talking about paracetamol, and if these kind of pills are okay for the children to take on, and is there any kind of side effects? Because some parents have also been seen that they don't allow their children to take so much of pills, and some children are also not bothered to have those pills. So do you prefer to give them any other medicines or something kind of like medicines to be allowed to them?
Aspirin, which was a known antibiotic before or analgesic before, should be avoided in this in this disease because of the potential to cause liver damage. So paracetamol is the only known and safe medicine that is easily available, which should be given to a child to give him the comfort from the symptoms.
It is mild as well, I guess.
It is mild and it is quite safe in therapeutic dose. I mean, if the dose is adequate, properly given, then it is very safe, and this can be repeated every 4 to 6 hours. So this is one drug I would definitely suggest, and parents can take it without fear of any toxicity or any damage happening to the organs. And besides that, sometimes influenza can also cause vomiting and diarrhea in a child. So many times we call it stomach flu, which is actually a misnomer. Suppose the diarrhea and dysentery is loose motion is happening without the other symptoms of flu, then this is not part of the flu.
Okay.
There are so many other kinds of gastroenteritis which can happen. So many times, this is misdiagnosed as stomach flu, but that is actually not stomach flu. Normally, the diarrhea and vomiting that we see in children will happen only with other signs of influenza.
Okay.
So adequate hydration and something to stop the vomiting. Something like domperidone or ondansetron can be given to a child to stop the vomitings.
Okay.
And adequate hydration orally should be tried. We have ORS, the oral hydration solution.
A proper intake of fluid is very important at this point in time.
That's what I'm saying. That oral hydration solutions can be given. Then we can give any other liquids, water, dal soup, coconut water. So many easily available fluids are available which can be given to a child.
Okay.
But if he is vomiting, then you need to control the vomiting with antiemetic medicine.
Okay.
So these are the other symptoms that we can control with medicines for the child to be comfortable.
Okay, so doctor, whenever a patient or a parent comes to you, so what happens is that sometimes they have lots of questions regarding their children, and it's very difficult for you to make them understand that it's not like that, or maybe because nowadays internet is all where, and they take all the lot of information, and maybe there are many information which is not correct, isn't it? So when they come to you and they ask you that we have seen an internet like this or we have heard something like that, so do you tell them that you should not follow those, or do you make them understand in your proper way? How do you do that, doctor? I'm sure you must be facing some kind of problem as well.
The problem with internet gives you a certain amount of information for sure, but again, from which side you have taken it and whether it's a genuine medical site or not, all those things matter a little bit. And secondly, there are so many diseases which overlap. The symptoms will overlap. They look the same. Even you'll get headache in dengue, fever in dengue, high fever. So many person who's got dengue might think that he's got influenza. Or somebody having influenza might think that he's got dengue. So this is very difficult to differentiate, even for a medical professional.
Okay.
So overlapping of symptoms and as well as signs can really confuse the parents. So I tell them that with my medical experience or my knowledge, it is easier for me to tell you that this is not this but this.
Okay.
And whenever in confusion, we take the help of investigations. So parents, when they take information from the internet, they cannot really differentiate these overlappings.
Okay.
And many times they do not take the information from the correct sites or the correct places.
Okay.
So that is the reason they get confused. So I tell my parents that use the internet, but then you should be also careful in interpreting what you read or what you understand.
That's very important, and I would like to again repeat to the viewers out there that if you have any confusions and I'm sure you have a lot of search on internet, but as doctor has just mentioned, that if you have a lot of search and you have a lot of information with you, but believe on that if you have full-proof connection with that. Otherwise, you just meet a doctor and have your clear-cut confusions and have a confusions cleared by the doctor itself, because he will give you the proper answers, as he had already mentioned that diseases are many and it might change at the time of being. And doctor, as you have clearly mentioned, that when parents come to you and they tell you that we have to make a lot of suggestions to them, isn't it? So what more you want to add on that?
See, now for diagnosis, I would say that to diagnose influenza absolutely 100% accuracy, with 100% accuracy, it was difficult before, but nowadays we have many molecular tests which can give us correct diagnosis. They are a little expensive, but then they are available now.
Okay.
Something like the PCR test or the serological tests which are easily available. And then also we have the cultures which are difficult to get, but then it is possible if someone needs. So confirming the diagnosis is possible, but then those are usually left to patient or children who have severe disease, severe pneumonia, ARDS.
Okay.
Those are situations we need to confirm that this is influenza, nothing else.
Okay.
But majority of the children who will have a minor kind of disease, this tests are not required. They are treated like a normal cough and cold or normal common cold, and they get well. Okay. So the reason influenza is discussed so much is because of its potential to cause complications.
Okay.
So that is the reason we are trying to say that prevention is better.
Better.
So preventive health tips which I just said should be followed.
Followed.
And vaccination if possible should be given. especially to the high risk children.
Okay, doctor, we'll talk of that, but we'll just take the call. Okay, hello, who's calling? Hello.
Hello, মই বিনিতা কৈছো পৰা। হয় মোৰ বেটটো আজি অলপ আগত জ্বৰ উঠিছে, এঘণ্টামান হৈছে তাৰ জ্বৰ উঠা, তাৰ বয়স 3 বছৰ।
3 বছৰ।
কিমান সময়ত মই পেৰাচিটামল দিব পাৰিম?
ওজনটো কিমান হ'ব বাৰু?
তাৰ ওজন 13 কেজি।
আপুনি পেৰাচিটামল 250 মিলিগ্ৰাম পাব, তাৰ 3.75 ml দিব। সেইটো 4 ঘণ্টা 6 ঘণ্টাৰ মূৰে মূৰে দিব পাৰে, কিন্তু জ্বৰ যদি 101 বা তাতকৈ বেছি থাকে তেতিয়াহে দিব। কম জ্বৰত আপুনি অলপমান শৰীৰটো মুচি দিব পাৰে, গোটেই শৰীৰটো কুহুমীয়া গৰম পানী দি মুচিব, ঠাণ্ডা পানী ব্যৱহাৰ নকৰিব। 2 দিন বা 3 দিন চাব পাৰে, যদি একেবাৰে কম হোৱালৈ নাম লোৱা নাই তেতিয়াহ'লে আপুনি ডাক্তৰক দেখাব লাগিব।
All right, thank you so much for calling. All right, so that was our viewers. I'm sure the viewer you have just called must have got all your answers, what just doctor has mentioned to you. So coming back to you again, doctor, so you were talking about, and the topic, the influenza or the flu which we have taken. So if we talk about the preventions and the healthy habits, you have already mentioned that the parents should be very careful, especially when they are school-going children. When they go to school, they don't see, they meet up their friends if they are already infected with some kind of disease, but they don't see that they should not sit with them. So in that mode of time, like, what do you think? The school authorities also should take any of the initiative, and do you also plan some kind of programs as well?
See, there are many schools now who are conducting health classes or preventive health classes in schools, so that the children understand the importance of preventing disease by healthy ways, by eating healthy. Again, children, they are they forget, and they especially forget when they are playing. So they forget to wash hands. So this has to be repeatedly done, and organizations who are dedicated with this kind of ventures to increase awareness amongst children should be more active. And many other programs even we have participated, but then that is not feasible on a regular basis. So I think even the paramedical staff or people who are involved with NGOs and other organizations who have this will to do good with children's health can get involved in teaching children how to have healthy, good habits.
Okay, doctor, we'll talk on that. We'll have another call. Okay, hello, who's calling?
Hello, মই পালিপাব কৈছো নবকৈয়াৰ।
কওকচোন।
ছাৰৰ লগত কথা এটা পাতিব আছিলে।
পাতক, তেওঁ শুনি আছে।
ছাৰ, মানে মোৰ ছোৱালীজনী 3 বছৰ বয়স হ'ল, তাই জন্মৰ পৰা মানে কিন্তু খুব ৰাফ, আৰু মানে কি হয় গৰমত অলপ ঘামিলে গোটেই গাটো ডাকি দিয়ে, আৰু কণী খালে খুব বেছি হয়, কৰিব লাগিব।
বুজি নাপালো, পিছৰখিনি কি ক'লে?
মানে কি হয় গৰমত ঘামটো খুব বেছিকে ডাকে,
ঘামটো বেছি হয়,
আৰু মানে তাপ হয় একদম জন্মৰ পৰা, আৰু ছাৰ কণী খালে খুব বেছি হয়, কণী খালে বেছি হয়। হয়,
চাওক, মানে প্ৰথম কথাটো তেখেতৰ হৈছে যে ছালটো খুব ডাঠ। এতিয়া আমাৰ ছালটো আমি জেনেটিক, মানে আমি মা দেউতাৰ পৰা পাওঁ বা আমাৰ পৰিয়ালৰ পৰা পাওঁ। গতিকে ছালটো কিছুমানৰ বেছি ড্ৰাই হয়, কিছুমানৰ খহটা হয়, কিছুমানৰ ছালটো হয়তো তাতকৈ মিহি হ'ব, কোমল হ'ব, বেছি চেঞ্চিটিভো হ'ব পাৰে। এতিয়া কাৰ কেনেকুৱা ছাল সেইটো আমি লগত লৈ অহা বস্তু, সেইটোক আমি বদলাব নোৱাৰোঁ। গতিকে আপোনাৰ শিশুৰ যিহেতু ছালটো বেছি খহটা আৰু সহজতে ঘামে বা সহজতে এলাৰ্জিৰ নিচিনা হয়, গতিকে এইটোক দূৰত ৰাখিবৰ কাৰণে আপুনি স্কিনত বা ছালত আপুনি এটা মইশ্চাৰাইজিং ক্ৰীম লগোৱা কৰক। সেইটো যোনটোৱে আপুনি ভাল পায়, বেবী ক্ৰীম হওক, লোচন হওক। গা ধোৱাৰ পিছত এবাৰ অলপমান গাটো ভিজি থকা অৱস্থাতে লগাব, আৰু ৰাতি শোৱাৰ আগতে আকৌ অলপমান গাটো ভিজাই লৈ লগাব পাৰে। ঠাণ্ডাৰ দিনত যিহেতু ছালটো বেছিকৈ শুকায়, হয়তো 2বাৰ বা 3বাৰো লগাব লাগিব পাৰে। যদি এনে কৰে তেতিয়াহ'লে আপোনাৰ ছালটো কোমল থাকিলে ছালৰ যিবিলাক অসুবিধা, ঘামচি তামচি বিভিন্ন ধৰণৰ অসুবিধা, সেইবিলাক হয়তো কমকৈ হ'ব। সি যেতিয়া খেলা ধূলা কৰে, চাব যাতে ধূলিময় জেগাত বা য'ত পোক পৰুৱা মহ মাখি থাকে তেনেকুৱা জেগাত যাতে সি খেলা ধূলা নকৰে, কাৰণ ধূলিৰ লগত সংস্পৰ্শ হ'লে বা ইনচেক্ট বাইট হ'লে, পোক পৰুৱাই কামুৰিলে, মহে কামুৰিলে এলাৰ্জিবিলাক হ'ব পাৰে। কণী খোৱাৰ লগত যোনটো কথা কৈছে, সেইটো মোৰ অলপমান সন্দেহ আছে, কাৰণ কণীৰ পৰা এলাৰ্জি হ'ব পাৰে, এইটো মানি লৈছোঁ। কিন্তু যদি কণীৰ পৰা হৈছে তেতিয়াহ'লে সেইটো প্ৰত্যেকবাৰেই হ'ব। আপুনি এটা কথা চাব পাৰে যে যেতিয়া তাৰ ছালটো সম্পূৰ্ণ ভালেই আছে, সেইটো সময়ত আপুনি যদি কণী দিছে আকৌ একেই হৈছে, তেতিয়া আপুনি জানিব যে হয়তো কণীৰ পৰা এলাৰ্জি হয়, আৰু তেনে ক্ষেত্ৰত আপুনি কণীটো এৰি চলাটো ভাল হ'ব। এটা বয়সলৈকে সাধাৰণতে এলাৰ্জিবিলাক পাৰ্মানেণ্ট নহয়, যদি 5-7 বছৰ পাৰ হৈ যায় তাৰপিছত আকৌ লাহে লাহে আপুনি কণী দিয়াৰ অলপ অলপকৈ কণীটো দি চাব পাৰিব
All right. Okay. So I'm sure the viewer who have just asked the question must have got all your answers. So maybe if there is any other confusion, it's better to see the child. After seeing the child, you might give more information, isn't it, doctor?
Exactly.
Because now you have just heard him. You have just heard whatever the queries he had with you, and he just asked you regarding the egg which he has. But you have to go to the proper diagnosis of the children, isn't it?
Right.
Okay. So, doctor, coming back to the NGOs you were talking about and the awareness campaigns in schools, they have already started to make children aware about the good and the bad habits. So, what were you saying more on that?
See, awareness is important because, you know, several millions of cases happen every year in all over the world. Out of that, about 2.5 to 5 lakhs people die of influenza.
Okay.
So it is not a small burden. We are talking about a huge burden, and the significant population who gets involved with influenza are children. And as we know that there are 3 modes of communication, as I already said. So this modes of communication is highly, you know, potential in the schools because there's overcrowding, there's close contact. And there is, you know, the children will have a habit of touching their mouth, eyes,
Okay.
Nose. So all 3, you know, mode of infection will play in a school-like scenario. So, and the one more important thing is that the virus infects you even before a child becomes unwell.
Okay.
Suppose the virus gets into me today, I'll take about 2 days time to manifest that I'll have fever, cough, cold and all that. So in this latent period, that is the two days period, the child might be going to school. So he will end up infecting other children. So the only way we can prevent influenza from, you know, coming to children in an epidemic form is by, you know, by instituting these healthy habits.
Okay. And doctor, if we talk about the children, who are the children most affected by these kind of diseases? And is immunity one of the factor if we talk about the immunity factor in children? Is that also one of the important factor?
See, immunity plays an important in all kinds of diseases.
Okay.
So if 5 people have the same illness, they'll all behave in different ways.
Okay.
Because your internal immunity or your
That's plays a very important role.
milieu has a different way to handle everything. So yes, the same disease will manifest in different ways. But as such, children who have cough and cold, frequent cough and cold, or children who has asthma, or children who will have an underlying immunodeficiency condition, these are the children who will have severe form of influenza with complications.
Okay. All right.
So if we come across a child with these situations, then we are obviously more careful in handling them, and we should be alert to, you know, see for complications and treat them on time.
All right, doctor, we have a lot of discussion and phone lines are already coming. So right now we'll have to slip into a short break. So viewers, don't go anywhere because we'll have to slip into a short break, but do come back soon because we have lots more on the other side.